everyone. My name is Dr. David Kowalczyk. I work with Colorado Facial Plastic Surgery. We've designed a series of educational lecture videos which are short and hopefully provide some information about some of the common procedures that we do. We feel it's really important that patients understand the anatomy and some basic concepts behind the procedures to be an informed consumer. If you have any questions, concerns, or comments, feel free to leave them at the bottom of the video on our YouTube link. We would really appreciate it. Thank you. Hi everyone. In this lecture we're going to talk about neurotoxins or neuromodulators. Sounds like a scary term, but what it's really referring to are things like Botox, Dysport, and Xeomin. On this slide, this is a picture of the bacteria which was initially discovered that contained the compound called botulinum toxin. So you might have heard of botulism in the past from canned goods causing people to have paralysis and die from that. Well, we've taken that molecule and distilled it down into its most pure form and modified it slightly in order to create things like Botox or neuromodulators that when they're injected in small quantities in areas of the face, they can help reduce some of the depth of wrinkles and create a nice softening effect to the face. The three most common types of neurotoxins on the market are Botox, Dysport, and Xeomin. There is a fourth one that's had a bit of controversy called Juvo, but these are the three that we carry at Colorado Facial Plastic Surgery. Each of them is a modification in some form of the botulinum toxin. There's different proteins that are added on that make them act slightly differently, which we'll talk about. When we talk about Dysport, we'll have to keep in mind for the purpose of this lecture, and if you end up getting some of these neurotoxins, that there's a conversion factor that plays in. That 1 unit of Botox or 1 unit of Xeomin is really equivalent to about 2.5 to 3 units of Dysport. So in general, we have to multiply it by about 3 when we're talking about how much Dysport somebody needs. So this is a chart that I created that talks about some of the general differences between these three products. Botox works in about 3 to 7 days after it's injected, and this can vary widely between people, but that's the rough estimate. Dysport works a little bit quicker, starting at about 48 to 72 hours, and Xeomin is probably somewhere in between the two, a little bit closer to Dysport than it is Botox. Botox, when it's injected, tends to act very locally, whereas Dysport ends up dispersing to the muscles that it's injected, so it's a little more widespread. Xeomin also stays pretty local. You might have heard the term of somebody developing some resistance or tolerance, the idea that they have to have increasing amounts of units to achieve the same effect. There is a thought process that people can develop some sort of resistance to this over time. That can happen with Botox and Dysport. It's actually less likely to occur with Xeomin, which is a product that we often switch people to if, for example, they've been using Botox for a number of years and are noticing that the effects are decreasing. Botox lasts about 3 to 5 months, Dysport about 3 to 4 months, Xeomin about 3 to 5 months. That can vary widely, but I'd say most patients are getting this done about every 3 months. The average amount of units that we inject on the face is typically 20 to 40 units for Botox, 60 to 100 units for Dysport, so basically we're multiplying by 3, and 20 to 40 units for Xeomin. The most common side effects that we see is really bruising. You can end up getting some headache in some of these in a very small percentage of people, but that's fairly uncommon. If that's the case, we switch products for you. One of the ways that we end up reducing bruising here at Colorado Facial Plastic Surgery is to use the Xeomin. What it does is it shows us a rough outline of where the veins are, particularly around the eyes and forehead, so that we can avoid or reduce the risk of bruising as close to 0 as possible. As many of you know, the facial muscles are where we inject the Botox. So this is a pretty busy diagram. The most important points are we do it at the forehead, at the frontalis area, the corrugators and the procerus here. Sometimes we do it around the nasal muscles, around the eye or the orbicularis. Sometimes for a lip flip up in the orbicularis oris, and at the mentalis down here for chin dimpling. This is an example of one of my patients pre and post treatment. This is the typical scheme that we inject here at the glabella, the forehead, and around the eyes, and this can vary in terms of the number of injection points and how many units we use. This is a rough estimate of what we use for the glabella, or the 11 lines, for the forehead, and for the crow's feet area. Well, thank you for your attention. I hope that you learned a little bit more about neurotoxins and what we offer here at Colorado Facial Plastic Surgery. If you have any questions, comments, or concerns, please leave them below.